What if one man's theories about dreams, childhood, and the unconscious mind fundamentally changed how we understand human behavior? Meet Sigmund Freud, the Austrian neurologist whose revolutionary ideas sparked both admiration and fierce debate that continues today. Born in 1856 in the Austrian Empire, Freud lived during a time of rapid scientific advancement and strict social rules. In Victorian society, topics like sexuality and mental health were often suppressed, making his bold theories especially shocking. Yet Freud dared to explore the hidden depths of human psychology when mental illness was poorly understood and heavily stigmatized. Freud's first groundbreaking contribution was developing psychoanalysis, a method of treating mental disorders through dialogue between patient and therapist. He believed that unconscious thoughts, repressed memories, and hidden conflicts drive much of human behavior. His 1900 work, The Interpretation of Dreams, introduced the radical idea that dreams reveal our deepest desires and fears. This concept revolutionized the way people thought about the mind's hidden processes. His second major innovation was mapping the human psyche into three parts: the id, the ego, and the superego. The id represents our primal desires, the I want it now part of the mind. The superego is our moral compass, the voice that says, that's not right. The ego mediates between the two, balancing reality with wants and values. This framework gave therapists a new way to understand personality conflicts and mental struggles. Perhaps Freud's most controversial idea was that childhood experiences profoundly shape adult personality. He argued that early trauma, parenting styles, and family dynamics leave lasting marks on how we think, feel, and behave. While many of his specific theories have been challenged, the belief that early development matters remains a cornerstone of modern psychology. A turning point in his career came in 1885, when Freud studied under French neurologist Jean-Martin Charcot in Paris. There, he observed hypnosis being used to treat hysteria, a disorder then believed to have purely physical causes. This convinced Freud that psychological symptoms could have psychological origins, a radical idea at the time. This insight laid the groundwork for talk therapy, now a core tool in mental health treatment worldwide. Freud once wrote, "The interpretation of dreams is the royal road to a knowledge of the unconscious activities of the mind." This belief drove his work, that to understand ourselves, we must explore not just what we think, but what we avoid thinking about. Of course, Freud's legacy isn't without criticism. Many of his views, especially about women and sexuality, are seen today as outdated, sexist, or culturally biased. Modern psychology has moved far beyond his original theories, grounding itself in scientific methods and diverse perspectives Freud never imagined.